Good morning. My name is Daisy. I'm a registered nurse, and today I'll be delivering an in-service to all you wonderful nurses here on how to provide educational resources on blood glucose level management and subcutaneous insulin application for patients with type 2 diabetes. Let's get started. So firstly, I'll just briefly go over what the content will be for today's service. Firstly, I'll talk about background. So what is type 2 diabetes? Who is primarily affected demographic? And what can happen if the illness is unmanaged? We'll then go into the learning needs analysis, and that's what methods I use to conduct an LNA to discover the gap in knowledge for the patients who are newly diagnosed with type 2 diabetes. We'll then go into the teaching methods. So using Bloom's taxonomy theory, I will discuss the domains in which my teaching methods sit and the advantages and disadvantages of these. Learning outcomes, here I will identify the two learning outcomes. And then finally, the assessment of the learning outcomes, which I will discuss the methods used to assess the patients and if these learning outcomes have been met through my teaching methods. So firstly, a bit of background on type 2 diabetes. So type 2 diabetes is actually the most common form of diabetes. Diabetes Australia has estimated that 2 million Australians are living with a high risk of developing the illness. And although it involves a genetic component, it is largely preventable and often associated with lifestyle factors. So, who are the affected demographic? So, the affected demographic increases with age. The Australian Institute of Health and Welfare Report 2017-2018 stated that 1 in 6 people 75 and over had diabetes. In the same report, men were at a higher proportion than women to be affected, although in more recent decades, the prevalence is increasing in adolescents and young adults around the world. So therefore, the affected demographic is ranged, and so the management and treatments for this need to be educated, understood by such a diversity in ages and genders. The illness immensely impacts on Indigenous Australians compared with non-Indigenous Australians. The National Diabetes Register underestimates the number of Indigenous Australians registered and recognises that this is an important data gap which needs further development. But in 2018-2019, the Australian Institute of Health and Welfare report does estimate that 1 in 10 Indigenous adults are affected by the disease. So that's a statistic we can roll off, which is really, really sad. So what happens with diabetes if it's unmanaged? Well, it can lead to numerous health consequences. And just some of these include heart diseases, strokes, high blood pressure, nerve damage, and kidney disease. So firstly, I needed to assess what are my learning needs? What do people need to learn more about their illness and their diagnosis? To assess my learning needs, I conducted a small focus group with 5 people aged between 30 and 75 years old who were all newly diagnosed and insulin-dependent type 2 diabetics. So what did we do? Here we had discussions as well as allowing me to observe the behaviours and techniques in regards to these patients' BGL readings and their insulin application. I asked each person to demonstrate how they conducted a BGL reading on themselves and then asked them to discuss their reading and what that number means to them. For those that required or that were due their insulin, as the time we conducted this was roughly just after midday, so just before the participants were about to eat lunch, had eaten lunch, I asked if they could also demonstrate how they administer their insulin. So I observed most people at it to do this. On observation, the gap of knowledge is the uncertainty in where to prick on their finger for an easy collection of blood for their BGL reading. I saw a lot of people prick further down on their finger and struggle to get the right amount of blood. And another gap of knowledge was the uncertainty on sharp safety when handling the needle for their insulin administration. As a nurse, it was very stressful to watch some of these patients handle sharps not so cautiously and very freely. The second method I used to assess the learning needs was a questionnaire. So I had 20 people who attended the Hunter Diabetes Centre to fill out a series of questions, again in relation to their diabetes management and their insulin application. So the gap of knowledge from these questionnaires showed one was a lack of understanding on treatment when experiencing a hypoglycemic episode. And although most patients had a good regular BGL routine for their checks, their knowledge for other circumstances outside this regular routine, when a BGL reading should be conducted, was really limited. And with this, I mean examples like before, during, and after exercise, after consuming alcohol, during illness or stress. These are all times when BGL monitoring is required to be increased in frequency due to the changes in the body's circumstances. And yeah, a lot of the patients here did not recognize the necessity for this and these lifestyle situations where they really need to be checking more frequently to monitor their sugar levels. So next up is teaching methods, and these are the educational resources and teaching methods that I chose to conduct to meet my learning outcomes, to fill these gaps of knowledge that these patients were struggling with. So these included two different educational resources, which I'll go through. Firstly was a video of the step-by-step process of blood glucose level management and subcutaneous insulin application for patients with type 2 diabetes. This video then followed by an interactive group practice session where each patient can have a hands-on practice of these skills. My second resource was a handout flyer that to give out as a resource for more knowledge on type 2 diabetes. Within this flyer, it offered a flowchart on how to address experiencing a hypoglycemic episode, as well as a list format of circumstances for when a BGL reading should be obtained. So these learning outcomes sit in the cognitive and psychomotor domains of the Bloom's taxonomy theory. Therefore, the appropriate teaching strategies included with my flyer in the cognitive domain, I had included images following the step-by-steps on how to treat hypoglycemic episode. And this flow chart and imagery is really great because it uses the imagery for memorization as well as be a tool which the person can repetitively refer to for full comprehension. So it's a physical resource they can take home and continuously refer to if they're unsure or have questions or just doubt themselves. The flyer, which also provided that list of particular circumstances outside the regular times when a BGL reading should be obtained, is another simple resource which will allow the person to recognise and distinguish when further BGL readings may be necessary to monitor closely. So I recognise that the flyers can be a disadvantage as they can offer an overwhelming amount of information which may not hold people's attention. and therefore they can struggle to comprehend all the information. But keeping the information simple, easy to read and follow, for example, that list format I mentioned, as well as the flow charts with pictures, all help towards keeping the reader engaged, and will contribute towards that cognitive learning abilities. In the psychomotor domain sits my short video and interactive group practice session. So with the short video, with the step-by-step process of how to obtain that BGL reading and how to administer insulin subcutaneously, it also included the correct handling of the needle and sharp. And this method is amazing as it will allow an exact visual representation of the procedure for people to sit and view it, right in front of them. After watching the video, the group each had a turn in both obtaining that BGL reading themselves and administering the insulin, as well as handling the sharp. If someone didn't need to administer that insulin, I supplied oranges so we could still practice this process. So these teaching methods are a great advantage as it gives a visual demonstration for the learner to observe and then allow the learner to imitate the skill. So it allows that hands-on experience, that hands-on interactive process. It also allows myself as the teacher to offer that hands-on help if required, that extra assistance. The process also allowed the person to create their own techniques, which best suit them and their bodies when doing this application, as these individuals will be attending to these skills numerous times a day by themselves. It's really important that they get their method, what works well for them, what they feel comfortable in, and how the process suits them best. Finally, I do also recognise it can be disadvantaged as it cannot be done in a large group, and that's because the learner needs the attention of the teacher, myself, and we all need a time frame for everyone to have a turn. So in these large groups, it can get restricted. Not everyone can have a turn. Sometimes the teacher won't have enough time and capacity to give to each individual, which can be a disadvantage. So this video and interactive session is definitely an advantage for a smaller group of people. So the learning outcomes from these educational resources include learning outcomes. 1. So patients are to demonstrate the correct process of a BGL reading, administering insulin subcutaneously, and the correct sharp handling by the end of the 1-hour group session. And the learning outcome 2 is patients are to have the knowledge or know where to obtain the knowledge to identify best treatment for a hypoglycemic episode and the lifestyle circumstances that the need for a BGL reading would be required. And this is all, again, by the end of the 1-hour group session. Finally, in order to assess whether the patients have reached the learning outcomes, I will evaluate them by, again, referring back to the Bloom's taxonomy domains that they sit in. So cognitively, I will test the patients will be assessed through a written quiz assessment, and this is testing their knowledge on the flyer, including the treatment of the hypoglycemic episode, and competence in identifying resource for BGL readings. If the patient is unsure of an answer, they will also be assessed on their understanding and where in the flyer they can find these answers. The psychomotor domain, as the assessor, I will observe the patients while they do a practical assessment of the procedures. So obtaining that BGL reading, including the best location to prick on their finger, as well as administering the insulin subcutaneously and their correct, safe handling of the sharps. So I understand that for a diagnosis of type 2 diabetes on an individual, this can be a really emotional and life-changing challenge. So I believe that when delivering these educational resources on the topic, it is so important that the patient feels comfortable to ask questions when they're unsure, and ultimately, for the final outcome is for them to walk away having greater confidence to manage their illness effectively themselves. And this is something really important that I believe as nurses we need to make sure that we're thinking and are wary of when delivering these in-services. So thank you so much for everyone for their time, and please feel free to come up to me or message me if you have any questions, if you have any input in other ways that you believe that when you've interacted with your patients and you've delivered education, how they've best responded to this. I really, would appreciate that input. Thank you so much, and hopefully see you guys soon. Bye.